Hi, I'm Dr. Sophia Yen, CEO and co-founder of Pandia Health, the only women-founded, women-led, doctor-led company in birth control delivery. And today is TMI Tuesday, where we talk about stuff you normally don't want to talk about, but we should talk about for the safety of your health.
Hey Dr. Yen, so what is PCOS?
That is a good question that comes up. 1 in 10 women have PCOS, which is Polycystic Ovarian Syndrome. And because it's a syndrome, we feel that it's many different things being kind of thrown in the same basket. And so there are what we call skinny PCOS, and then we have overweight PCOS. 10% of people with PCOS are skinny. 90% of PCOS women are overweight or obese, and therefore, if you're overweight or obese, you're more likely to get polycystic ovarian syndrome. What are the symptoms of polycystic ovarian syndrome? So the definition of it is irregular periods. So if you've missed 3 periods in a row and your periods are just kind of whack throughout the year, that's one of the criteria for polycystic ovarian syndrome. And then the other one is hyperandrogenism. So if you have more hair, more acne, or even like male pattern baldness compared to the average person or people in your family, then you might have hyperandrogenism. Another way to assess hyperandrogenism is we'll test your blood for your total testosterone and your free testosterone. And then the way birth control pills interact with PCOS is the birth control pills will often turn off your ovary, and your ovary in PCOS is sometimes taking your female hormone and turning it into male hormone, thereby increasing testosterone and acne and hairiness. And so by turning it off, it normalizes the hormone and has less of that male hormone circulating around. It also sometimes increases your sex hormone binding globulin, SBHG. And SBHG will bind testosterone, so there's less testosterone wandering around. And so picking the right birth control pill that maximizes your sex hormone binding globulin will decrease your risk of hairiness and acne. And so having a birth control expert, such as the panel we have at Pandia Health, is much better than having someone who only writes birth control once in a while, or somebody who's never written any birth control or doesn't write it as often. Thank you for watching, and check us out on all our social media. If you have any questions, DM us or leave us a comment below.